Massachusetts ranks near the top for getting health insurance, but many people with coverage have trouble getting treatment. That especially goes for people who need treatment for mental illness. According to a new study by the Blue Cross Blue Shield of Massachusetts Foundation, almost 40% of those patients had to go without treatment. To tell us about the report is the foundation's president, Audrey Shelto. Thank you very much for being with us again.
Thanks for having me.
Audrey, we're talking about people who need treatment for mental illness, but I guess also for people struggling with drugs too, right?
Right. The report is focused since 2006 on people in general trying to get access to health care, but this past year we really zeroed in on looking at people's, the experience people had in trying to get treatment for mental illness or substance use disorder conditions. So both mental illness and drug-related or other types of addictions. And what we found in the survey, unfortunately, sort of validated what many of us have probably experienced personally or anecdotally heard from friends, which is that it's very hard to get treatment for mental health and substance use disorder treatment. This study showed that over 50%, 57% of people who were seeking treatment for those types of conditions had trouble finding a provider who would see them.
I understand there are a number of providers who don't want to accept Medicaid, the Mass Health program, but is this just about Mass Health, or is this about across the board?
No, it's not just about Mass Health. It really is across the board. It's worse for low-income people, but it's a problem across the board. On the issue of providers taking insurance, a survey that we did last year on outpatient mental health treatment, so just mental health in this case, but you could probably generalize, 45% of the providers that we surveyed did not take Medicaid or Mass Health, but 36% didn't take Medicare, 18% didn't take commercial insurance, and 10% didn't take any insurance at all.
Now, is this simply because the providers say the reimbursements just don't do it for us?
I think it's a combination of things. I'm sure providers will tell you, and the survey that we did last year talks about rates. So rates are part of the issue. Many providers don't feel that they're being adequately compensated for the cost of delivering the care. Another issue, though, is a lot of providers talk about just the administrative burden associated with taking insurance. Getting credentialed, which is a process you have to go through to be part of an insurer's network, getting authorization to deliver the services, going back and getting more authorization for additional visits. So they talk about the administrative burden as well as rates.
Authorization, that means the primary care doctor. What about
even the therapist. If I'm seeing a therapist, and in some, depending on the plan, they have different rules. The therapist might have to get permission from the insurer to see me to continue seeing me after a certain number of visits, or to admit me to a hospital, those kinds of things.
So what does all this mean for someone who's trying to get treatment?
It's really hard, and it's an issue that we hope this study really serves as a call to action to address in the Commonwealth. It's complicated. There's issues that related to provider networks, as we were just talking about it. We have a very complex system in general. People don't even know where to start in trying to access services. People that are most affected by this problem, like we were just discussing, low-income people, they have a lot of other issues too that make their lives very complicated. So seeking health care is one of many challenges. Could have problems with housing, with food instability, insecurity, et cetera. So what I think we need to do is really recognize that we have such a significant problem with people accessing services for these critical needs, that we have to approach it as we did almost with health reform, which you and I have talked about before. We need to work together as a Commonwealth and think about, what are all the issues that are creating this problem, and how do we develop a solution that includes lots of different interventions that will try to improve it.
This is BNN News, and we're talking with Audrey Shelto from the Blue Cross Blue Shield of Massachusetts Foundation. Audrey, I guess one problem for people who need the treatment is that if they have limited options in where to go, they might end up having to do something that's way out of their way, pretty inconvenient.
Right. There's definitely a geography problem in that even with the providers that we have in the Commonwealth, and we have a lot of providers in the Commonwealth, there's not a geographic match always. So, for example, in central Massachusetts, we have fewer providers, so people in that area may need to go further. But I think even more compelling is people who have trouble finding a provider, and this is what the survey showed, face two options. Either give up, which a lot of people in the survey said they did. So they're just not getting treatment for conditions that they sought treatment for, or they end up going to the emergency department, which we know is not a good place to be for people with mental illness or substance use disorders, is much more expensive than care in the community would have been, and doesn't result in sort of ongoing treatment for the condition that they're seeking.
Another challenge here is that most of us, when we come up with the co-payments, we do it periodically. It's normal for most of us. But I think when you're being treated for mental illness or a drug problem, you got to do that a lot more often. What does that mean?
So I think, as you're pointing out, if you're in an ongoing treatment relationship with someone for a few months or something, those co-pays are going to add up. So the affordability can be particularly challenging. More, I would say, in that situation for middle-income people, because for the most low-income people in our Commonwealth who receive their care through Medicaid or Mass Health receive their coverage that way, they wouldn't have co-pays. So it's sort of that group in the middle that gets squeezed on that kind of situation.
What about remedies for this that we've been talking about?
As I was saying, it's the problem's complex, so I think the solutions are going to be broad and involve a lot of parties. I think one is trying to get more providers to go into the field of psychiatry or therapy or substance use treatment. One of the issues I think we can look at there is it's expensive to get training, to get graduate training in any of those fields. So I think if we look at programs like loan repayment, where we could offer to individuals coming out of their training that the state or a combination of payers will repay your loan, basically, your student loans, if you'll commit to serving the patients in the Commonwealth of Massachusetts and take any type of insurance for a certain number of years. Another area I think we need to look at is rates. I do think we have to look at rates and make sure that we're fairly reimbursing providers for the services that they're delivering. I definitely think we have to look at the administrative burden issue and try to streamline these processes so that whether it's a social worker, a psychologist, a psychiatrist, can focus on what they went to school and the reason that they went into this field, which is to help people. They complain about spending so much time working on paperwork that it's sort of taken all the pleasure out of the work that they feel so committed to. Another area that we're actually working on at the foundation is trying to see if we can replicate sort of the urgent care capacity that we have on the medical side. So if you think about you're feeling sick in the middle of the night, or you get an injury on a weekend, or when your primary care office isn't open, you go to an urgent care center. But we don't have that kind of service in the Commonwealth at this time for mental health or substance use disorder. So we're actually launching a new grant program to try to build off of the emergency service program that exists in the state to try to expand that out to be more of an urgent care capacity.
You should mention you've got this report online, I imagine, so
yes.
People can check that out somewhere?
Yes, absolutely.
Right. Thank you very much for being with us.
Sure. Thank you.
Audrey Shelto from the Blue Cross Blue Shield of Massachusetts Foundation.